Ifedola Poyetime. Um, this is my speech class. I'm taking a speech class at Pratt Community College. This is my informative speech assignment. Today I'll be talking about diabetes and how it affects the human body. Diabetes is a disease that is caused when the pancreas refuses to produce enough insulin to lower the blood sugar. So we have three types of diabetes. According to Foundation of Nursing by Christensen and Cockrell, type 1 diabetes is called the children onset diabetes. It's actually caused, it's most common within children. Children have it more than adults. Type 2 diabetes is the one that the adults have most, and gestational diabetes is the one that pregnant women have. It's actually within 24 to 28 weeks in pregnancy, and they have to do a test, a glucose tolerance test, to confirm that. If anybody has diabetes, there are lots of treatments for diabetes. You can do diet planning. According to the USDA food pyramid, you eat more of fruits and vegetables, less sugar, and the good carbohydrates. The carbohydrates that digest quickly, you eat less of them because they convert to sugar quickly in your body. And exercise is a good way to treat diabetes too, because most people with diabetes, they are either overweight or it's like an hereditary disease to them. And the last treatment is taking of medication or insulin to lower the blood sugar. If there are medications like metformin, you take it before or after your meal, depending on what your doctor prescribes. But insulin, if a patient is on insulin, they take the insulin after they check their blood sugar. They have a sliding scale for insulin. If the insulin is within a particular range, they take, if the blood sugar is within a particular range, they take a particular amount of insulin to lower the blood sugar so it doesn't go out of hand. Then there are some people that are at higher risk for diabetes than others. Those people, they are people with obesity. To know if you're obese or not, you have to check your BMI. If your BMI is high, then you're obese and you need to reduce your weight. The black people too have higher risk for diabetes, and age is another factor for diabetes. Then if somebody has diabetes, it is hereditary. Like if your parents have diabetes, the children can have it. So if our parents have diabetes, we need to do constant checkup and make sure they were not inheriting it from our parents. Diabetes is a disease that can happen to anybody. Children can have it, adults can have it. But when it's well managed, it's not a life-threatening disease. The prognosis is good. It's not like if you have it, you're gonna die. No. If you have it, if you do your exercise, if you eat regular diet, if you take your medications, you're gonna be fine. You will be fine. And according to Mayo Clinic, if you take your medications on time and you check your blood sugar on time, you don't go into hypo or hyper, then you will be fine. Like if your blood sugar doesn't drop so low or go so high, then you will be fine. My conclusion is that we should all do checkup regularly, and we should all be informed about our health. And diabetes is not a life-threatening disease. Does anybody have any question? Any question? Okay. Thank you. Once again, my name is Ifedola Poyetime.
Thank you for listening to my speech.
You're